Last week, Dr. Peter Juni, the science table head, called COVID right now in Ontario a tidal wave, a wave that's hitting our province hard. Public schools are being closed because there are not enough staff to keep them open. With the science table best data suggesting we've over 100,000 cases per day right now, that wasn't what the government predicted would happen. So why did the government remove the mask mandate for schools so early?
To reply on behalf of the government, the Deputy Premier and Minister of Health.
Thank you very much, Speaker. We have always taken a very cautious approach when it comes to protecting the health and safety of the people of Ontario with COVID, and we were among one of the last provinces to lift the masking requirements. I think it needs to be said that Dr. Moore has cautioned Ontarians for quite some time that as we lifted the public health measures and with the increased transmissibility of the BA2 strain of COVID, that we were going to see the numbers go up. We are seeing the numbers going up. However, Dr. Moore has also indicated that because we have so many Ontarians that are now fully vaccinated, with the increased use of the antivirals such as Paxlovid, and the capacity in our hospitals, we are prepared to weather this and to continue. This is something that was entirely predictable from the beginning. We knew this was going to happen, and we're prepared for it.
The supplementary question.
Thank you, Speaker. Public Health Ontario released some evidence last week. They state, quote, with expected increased infections among children associated with increased transmissibility of BA2, removal of public health measures, and limited vaccine eligibility and two-dose coverage in children less than 12 years, the number of children with severe disease is likely to increase. This may impact pediatric hospital and intensive care unit capacity and also lead to further disruption to in-person learning in Ontario, end quote. Speaker, Public Health Ontario is calling for bringing back the mask mandate in schools, especially as schools are now closing. If the government won't do that, will the Premier and the Chief Medical Officer explain why not?
Minister of Health.
Well, as I've indicated before, the Chief Medical Officer of Health does not believe that that's necessary. We knew that the numbers were going to go up, but because, and I'll just quote Dr. Moore, we have tools that we did not have just 2 years ago, including highly effective vaccines that have changed the course of the pandemic, high vaccination rates that continue to improve as more and more Ontarians see the value of getting boosted to protect themselves, their families, and their communities. Thankfully, the people of Ontario have responded to the call for higher levels of vaccination. We're seeing higher levels of vaccination in young people as well. And so while the numbers are increasing, we know that we have capacity in both our adult hospitals as well as our pediatric hospitals. The numbers have risen slightly, even as the number of people with COVID increases. However, people are not generally requiring hospitalization or requiring admission to intensive care units.